But for those who are unfamiliar with the term and what it does, what exactly is VO2 max?
Sure. So VO2 max is the maximum amount of oxygen that your body can utilize, right? And it's measured in liters of oxygen per kilogram per minute. And it's basically as simple as you want to describe it is how well your body can utilize oxygen. And so VO2 max is this integrator. It's this integrator of your cardiovascular system, your muscular system, your respiratory system. All these need to really be working together to see how well you can utilize oxygen. So VO2 max is a great marker that we use. Clinically, we love it because we can point to a lot of literature. But the way that we test for it is something called metabolic breath analysis. And people are obsessed with VO2 max, and we can talk a lot about VO2 max. But what I find really interesting clinically for us, and even for some of the patients out there, is all the other metrics that we get along when you're looking at a VO2 max. So we can look at things like fat oxidation rates. We can look at people's resting metabolic rate. We can look at their mitochondrial function, how well they're utilizing fat oxidation versus carbohydrate oxidation. We can look at their fat max. We can look at how efficient they're moving. We can look at their respiratory rate, and we can identify any limitations. They might have a limitation when it comes to the respiratory system, or a limitation when it comes to cardio limitation. And so there's so much great data that we can get to use, and how we kind of personalize treatment and how we can actually prescribe exercise. And VO2 max is just the end integrator of all those things. Basically, that final number that tells us how the entire system as a whole is working.